love studying medicine, but actually along the way seemed to pick up all these different skill sets and things. I think just generally following what interested me, which is what I really always say to people who are looking to get into health tech, is just follow like what excites you. Co-founded with a friend the Imperial College School of Medicine Coding Society, so we loved coding. We kept meeting up to talk about it, and then we were like, maybe other people want to learn this skill. So we made a society, which I also think is a great way, actually, if you're a med student, to get into the mechanics of starting something new, like a startup.
Someone that started a society at university, I've never met a bad one. Like it seems to be some sort of indicator of wanting to start something from scratch, be quite entrepreneurial, like it's like willing to just do something when you could easily do nothing.
It's always like medics trying to, how do I get into health tech? And joining one of these communities is probably a good way to start.
Hey everyone, this week delighted to be joined by Laura Tan, COO co-founder of Avid, and friend of mine, I think I can say now. We've seen each other enough. Definitely, right? So, two friends chatting. This is going to be so proper fly on the wall stuff. Laura, how are you? How's things?
Yeah, good. Thank you. Thank you for having me. Like we were saying, I'm a mega fan of the podcast and the events and just the community as well, right? That you guys have built is amazing. So yeah, this is great.
Oh, community. That's a good one. There's a lot of communities popping up at the minute, and actually. Yeah. I know that you dropped a comment on that I started the next gen one, but there's a load like that you'd be probably very qualified for. There's the doctors leaving, there's the doctors managing medical teams, there's the like Claudia setup, there's there's so many communities popping up in the minute. Like, what do you think of them? Because I have a view on like putting people into a WhatsApp group doesn't quite work. You've got to do something else, but I've got a biased view because I'm doing one, but also it's one of the things I actually wrote a massive 5,000 word essay on when I was when I did my master's in education, which was on online communities and how they're an absolute nightmare to get up and run and keep going. But I don't know, what have you thought of all the? Are you in any of these communities?
Yeah, there's definitely there's a lot of them, and actually I suppose it's really exciting that there's so much momentum for it. I think Healthtech's having a real moment, which is great. I think you're right. It's hard. You've got to find the right ones with the right quality, right? Because it's all about where you spend your time, and there's a lot out there, and it can be a lot to sift through, I suppose. But I think there's a lot of value. I think it comes up because, and I talked to quite a few people about this. It's always like medics trying to, how do I get into health tech? And joining one of these communities is probably a good way to start. But it's there isn't like a set path to do it, I suppose. So I think a lot of time it's people looking for answers to that, and I don't know if it depends who you're listening to, right, in these communities as to.
So true. People are craving it. People are craving it. Well, there's two things people are craving: community, and medics are definitely craving to leave medicine. So if you put anything in there that might even help in the slightest with a really low barrier to entry, everyone's going to jump in, definitely. But that's broadly what I want to start by asking you. Obviously the first question that I ask for everyone here is to tell your story, but yeah, you've got I guess a version of that, right? So tell us your story, Laura.
Yeah, so background as a doctor, so trained at Imperial College Med School, graduated, loved my clinical career, really, really enjoyed the work, but I think there was always a pull towards the tech side, and what I've now later discovered actually is probably product is on the product side. So I think that was a real passion for me, probably pre-med school, but I'll start from med school just for time. But essentially, love studying medicine, but actually along the way seemed to pick up all these different skill sets and things. I think just generally following what interested me, which is what I really always say to people who are looking to get into health tech, is just follow what excites you. And I think for me, I did a BSc in cardiovascular sciences and had the opportunity to do a coding project. Didn't love the lab. Caught the bug, learned Python. We did a project on automating image analysis of echocardiographic images. And I think just loved it. And actually I've now later come to realize didn't necessarily just love the coding part, but I think the building part of creating something from scratch. And there's sort of a creative element, but also a technical element. And then also co-founded with a friend the Imperial College School of Medicine Coding Society. So we loved coding. We kept meeting up to talk about it. And then we were like, maybe other people want to learn this skill. So we made a society, which I also think is a great way, actually, if you're a med student, to get into the mechanics of starting something new, like a startup.
I look for it on CVs specifically. Someone that started a society at university. I've never met a bad one.
Yeah.
Like it seems to be some sort of indicator of wanting to start something from scratch, be
Yeah.
quite entrepreneurial, like like willing to just do something when you could easily do nothing.
Yeah.
Like it's definitely some sort of indicator. You're proving my point, Laura.
Yeah, yeah. Well, it's passion driven, isn't it? So you mean we started
Mm,
this, we ran courses teaching people to code in Python, we did a hackathon, speaker event, and you're learning all the mechanics, I suppose, of you mean some branding, some marketing, some event organization, some
100%.
so yes, I mean loved that. And then was lucky enough to do an academic foundation program, which I think was
Mm,
really key in my entrepreneurial journey. So actually I did it in Cardiff where you got a day a week rather than the block, you got a day a week for academic activities for the whole of F1 and F2, which I slowly sort of transitioned. So initially a lot of academia, so a lot of big data work. I found the coding skills were pretty helpful from a data science perspective, doing a lot of data visualization. We did some things on wearables. So that was really a great route, I think, to chase down what I was excited about there. But slowly pivoted it. So then started building apps and then made a medical education app, building websites for different groups. And then, yeah, I think I joined the NHS Clinical Engineer program, was just slowly kind of chasing down all these different routes and ways to get involved in things. And then I think maybe COVID was quite a good shifting point where I think I was coming to the end of F2. I knew I wanted to do something different. Like I say, I love medicine,
mm,
but was really excited by whether it was going to be startup or leadership or med devices or something kind of different for my what I planned to be my FY3 year. Um, COVID came. I lived with medics. We got locked down all the time. Just for fortunately, I mean, none of us got particularly unwell, but there was so many sort of 2 week blocks where we couldn't leave the house.
yeah.
So did more coding courses, learned to build more apps in Flutter, built a again more med ed apps and things like that, and just
Wow.
started creating things, I think. And then met another mutual friend of ours, who's Jean Neem, who is you mean an absolute like legend in the space of health tech
Absolutely.
in terms of driving innovation. And yeah, we can speak to that a little bit more. But he put me together with some of the engineers he'd worked with previously. I think I was in a phase of just like talking to everyone and anyone I could find about what could I do. I'm excited by learning about your
Mm.
journeys and things. And then started building things with Matt and Mish, again, the most amazing, fastest building engineers you would ever meet. And then that slowly kind
Wow.
of snowballed, I think, to Avid, and then stepped out at FY3 to see how far we could take it. And then now I don't even know what year I'm in at this point, but it's been a good few years, and I'm full time startup. You mean loving the journey and just trying to build the company and kind of yeah keep up the
Amazing.
momentum on it.
I hadn't appreciated you'd built so much stuff. That's crazy. Like you've clearly got this like drive. Where do you think that comes from? Like this drive to like put things in the world that don't exist already. Like what are you trying to do there? Is it solve? Is it solve problems? Is it that you're fascinated by the tech and just want to express yourself through tech? Like what do you think's like driving you there?
Yeah, it's a good question, and you're right. I think as I reflected more on why I love product and ops, and maybe we'll speak to this of
Yeah.
like trying to find your place in like what is health tech, what is startup. But I
Right.
think you're right. That kind of core of building things was always something. I think it's a combination. I think there's a real excitement about making something, and you've spoken to this about making something from nothing that
Yeah.
didn't
Right.
exist before.
Well,
But
it's
I think
one of
yeah,
Jean's quotes that you just
yeah,
mentioned. Yeah, that's the one of the best things that's ever been said to me. Like at the start of that phone call when he said,
yeah.
"I just want to say congratulations for building something from nothing because I know how hard that is." I was like, "Oh God, I'm kind of like welling up at the start of this
Yeah.
business call. Like, oh God, I feel so seen. I'm so tired."
Yeah, it's good to remember that, right? Because yeah, you can get a bit lost in the weeds of things. Then you're like, oh,
Yeah.
actually, this is something that didn't exist before. But yeah, I think definitely that. I think it's all problem solving, isn't it? It's like you're kind of seeing a gap,
Mm,
and you think I can make something to fit that gap,
mm,
and then maybe a bit more indulgent on the sort of just creative side. I think it's just so fun to
yeah.
tinker around and try and get it right and test it with people, and yeah, add features, iterate.
God, it's so interesting because yeah, I mean, ending up in product just seems like so obvious when you break it down like that. That creativity and the build and putting something into the world and all that sort of stuff.
Mm,
I actually I actually overheard a podcast or listened to a podcast. Kind of overheard it because one of the things I'm actually doing is putting out other shows on the Healthtech
mhm.
podcast. So Keith Grimes is going to have a show on this
Awesome.
podcast, and he spoke to a product manager, and I hadn't appreciated I guess the nuance of what a product manager actually is, and all these sort of in jokes about, oh, we're not project managers, we're product managers, like all that sort of stuff, and
Yeah.
how do you define product? Like, what actually is product for people listening?
Yeah, so I think product is ultimately defining what needs to be built. But I think the nuance of that is that you're really sort of the glue that holds a lot of things together. So you mean you'll
Mm,
have really technical people who are amazing at building things, whether that's hardware engineers or software engineers. You'll have commercial people who you mean want to kind of sell this big vision. And then I think really interesting on the clinical side, then you've also got clinicians who you mean, is this product useful? Does it actually fit in practice? So I think as product, and my lens is very much on the health tech side, but from my
mm,
understanding, you mean product is around pulling all those things together. Your engineers might be amazing, but they can build anything in the world. And especially for
mm.
Matt and Nish and our team, they'll literally build you any fancy AI tool, I don't know, engaging consumer tool. But in terms of what needs to be built, I think that's your job at product, is to say, this is the goal we're going towards. And also I feel like I do a lot of stripping back scope. So again, you can build anything in the world, but how do we keep pulling things away to say, you know what,
Yeah,
this is the thing we need to validate? And then that again is another big part of product is what's that core? I'll define it. I'll make sure it's clinically relevant. I'll make sure you can also build it so it's feasible, and you'll work close with engineers on that. Maybe you'll work with designers to say what should it look like, and then again keep stripping that back down to say, okay, great, and then how are we testing this, and start putting it in front of users. And again, you'll interface with lots of other parts of the company on that, but I think your
mm,
job as product is to really provide that core driving force and make sure that everyone's building towards the same thing so that you'll get
yeah.
something cohesive at the end. But yeah.
It's really sort of entrepreneurial role, isn't it? I think I would be product if I wasn't doing what I was doing, because it definitely pulls on all the things that I like, all the things that I think I'm good at, and sort of lets me get away with doing, like, not doing the things that I don't actually like doing, like
Yeah.
selling like aggressively and like all
This
this
is
sort
the
of stuff.
thing, right? You have to wear all the hats in startup, which I've become more accustomed to, of like getting more commercial. You mean you
Yeah.
don't have a HR department, a finance department, all these
Oh.
things you'll have to do. But that's where the fun is, it for me, is definitely in product.
Yes, and learning. And it can be uncomfortable to learn new things, and it can be unpleasant to learn new things, especially if you're learning new things via making mistakes. It can be deeply unpleasant, but
Yeah.
when you do zoom out, that is where the fun is. I do totally agree. And seeing the person you become and all that sort of stuff when you're in a startup and a co-founder and all that kind of thing, I think is wonderful. Before we move
Yeah.
on to talk about
I've
Avid
got,
though,
oh, sorry.
oh, you
I've
go for
got
it, go for
a
it.
quick note, just as you mentioned Keith Grimes, I was just thinking that it
Oh yeah,
also entertaining kind of plays into my story from way back, where again I was in that sort of med school phase of just knowing that I love tech. I was super excited about building. I did the NHS hack days, which I'd super recommend. That they're really brilliant. And actually I met Keith Grimes again. I was probably
ah,
maybe a third or fourth year, fifth year med student, and we built we called it Karma. It was a VR procedural distraction product, and you build this over
amazing.
a weekend. There was a great team of like VR engineers at the time, and yeah, just loved it. And he was always like me, super welcoming at the time as a figure in health tech. So maybe just a shout out to him as you mentioned him. But I
Awesome.
think it's one of those things where I've now found I keep coming back to things that I had found along the way at med school or during F1, F2, of people I'd met or events I'd gone to, or that's sort of how I met Jean, as he came
Mm,
came as a speaker to ISSM Coding Society conference, which I
wow.
also came back to because you mean it'd been a couple of years since I'd founded it. So I
Wow.
think following the things that interest you and excite you rarely go wrong, because hopefully you mean if that's the path you're going for, and the number of times I've reconnected with someone who came as a speaker to an event, or I met at a hackathon, like all these threads kind of do come together, I think. So yeah.
Yeah. So what I'm going to say here is, like, say it louder for people at the back, because you know what? In your background, you went and did
Mm,
stuff. You did things. You went to places. You went to hackathons. You learned coding. You took steps to advance your own skill and to get out your comfort zone and meet people. And it's through the people that you met. You talked about meeting
mm,
Jean, meeting Keith, meeting these types of people, that it builds your network and all sorts of stuff. And I think as people that often, as medics, like we're so taught to like put the blinkers on and
mm,
tick your boxes every year and you'll get to the next phase.
yeah,
And it sort of, it robs you of that feeling and that knowledge that actually the world doesn't really work like that. Like, it really
yeah,
doesn't. It is unfair, and you need to maximize your surface area for interactions that might go somewhere, or to, you can do that through picking up skills or going to places to meet people and
mm,
actually speaking to them and all these different things. And like, And that's the thing. There's that quote, like, you know, about luck, and, you know, it's funnier, the more I practice, the luckier I get. And it's true. Like, the more you go to events, the more likely you are to meet someone at an event that's likely to change your life and your career. So kudos to you. You've definitely, you know, got up and done stuff, which I absolutely love. And it's interesting to me all on the coding side as well. Like, I absolutely love that. And that's what I want to come to next, actually, because you said in your intro that you learned Python. Now, pulling in, like, you know, narratives from Keith and others on AI and where we're going with no code building, and how these LLMs and various models are now coding super well.
Yeah.
For the last sort of 5 years, the general advice, if you're looking to leave medicine and pick up a skill, or you're looking to develop a solution for something, or to learn, you know, rather than going on ward round and seeing problems, you want to go on a ward round and see solutions, then you should probably just learn to code. And if you can learn to code, you start seeing the world differently, and it becomes a skill that you can deploy later, and that can be your ticket out, and like all this different stuff. With the way that the world's going, like, how do you see the skill of learning to code? Is it still useful? If so, what's it useful for? Is it that you don't need to do that necessarily anymore, especially if you're aiming for something like product, maybe, like, is coding even useful anymore? Like, you see narratives all sorts, right?
Yeah, no, it's a really great question. Actually, there's something that, people ask me a lot, especially medics, like, do I need to learn to code to get a job in health tech, right? That's the obvious question. But I think I've got a long and complex answer, but I'll try and kind of bring it down. You make a great call. Like, you mean, we're in a world where there's more and more no code tools, and I think I always encourage people, especially around product, when you're building an MVP, like, look at what you can do with these no code tools, because some of them are really fast, and you can definitely, like, get some sort of prototype up really quickly without necessarily learning to code. So it's definitely not an essential skill. It's definitely one that's done me really well. So I think it definitely still has a lot of value, even in a world of increasing no code. You mean, there's always understanding the mechanics of something, of what you can build and how you build it, I think is always going to be valuable, especially as a product
just to
role.
interrupt you, sorry, that there is my hunch.
Yeah.
Because I think in healthcare, you can get trapped in a mindset based on whatever your first job was, and that can be your mindset. So my hunch was always that it teaches you a different way to think, which I think is what you're saying.
I think so. And also, like, what's possible and what's feasible and what the lift is for different things. So for example, although in my current now day job, when I'm wearing my product hat, I'm not the one building the Avid app necessarily. My amazing engineers are building that far better than I ever would. But I understand, you mean, how can we reuse components here? Like, that would be a really big lift. That's probably a bit of an easier one.
So you know what
we
to
can
ask
use
of
this
them.
AI tool or this other API. Let's pull it. So I think having that sort of tech literacy is really useful. But then I also say to people, I think for me, learning to code was super valuable. It's also a great way for your med student to get publications out, because actually data science skills, running some stuff through R to make some graphs and things, like, you'll find that is maybe another tangent we can head down.
Let's go down that tangent.
Okay.
What do you mean running it through art, did you say?
So R is like another programming language. So it's just a discovery I made along the way as a junior doctor, that a lot of people have, a lot of consultants, and I'm not doing to say, but have very large Excel documents filled with horrible, messy data that they've been collecting for years and years, but it needs someone to sort of go through, sort it, clean it. And actually the skills of, managing a database, pulling out some insights, running some basic stats on it, are actually quite valuable ones. And I think maybe at med school, medical stats always seem so boring, but it's actually really cool. And I think if you figure it out, and a lot of these pipelines are very repeatable, but essentially learning some basic coding skills, some basic data analysis, run some t-tests, do some power calculations, take someone's horrible Excel database, but put it into a nice, clean, readable format where you can actually give them some insights from it. And then you can shape papers around that, of course. And
I can remember, that reminds me of, I remember when I did my fellowship year, I went to the TEDx NHS. It was being set up actually by a few of the other fellows. And they put on this TEDx NHS thing. And one of the speakers was someone in data visualization for the BMJ, I believe. Cool. Like, they had a whole department or like team that did this stuff. And they gave this talk, and oh my God, I had my mind and consciousness completely blown apart here and blown open of like what is possible to visualize. And it is this is the worst possible segment for a largely audio based podcast here to start trying to talk about this. But like, what I will say is you can visualize some incredibly complex conclusions or results or basically information, and you can tell a story through a static or slightly moving image as well, where you're like collecting the density of dust in 3D space to visualize, like, I don't know, something to do with the disease variants within a population or something, and all of a sudden you're like, oh right, yeah, in like 2 seconds I now completely get this by just looking at an image. It is an incredible skill. And actually I think if anyone is listening that is interested in art and creativity and also statistics and mathematics, like, that might feel like a strange world that you're in, but like, my goodness, what a world to be in. Because I actually think as well with the advent of AI and how copywriting has now become like, you know, completely absorbed and not a skill, and what we're thinking loads about is how do we express creativity as a means of creating good content. And one of the questions we're asking ourselves internally is what can AI not do that humans can actually do? And I think largely, of course, there'll be an AI component in getting there, but actually to have the idea or to figure out what visualization would appeal to a human brain, I actually think it's an incredibly interesting space.
It's a real sort of art to it, right? But also for healthcare professionals listening, your clinical lens that you'll put on that as well is, again, super valuable. So it's a really nice, it's a really fun space, I think.
Completely.
Just so I don't forget, but on learning to code, the other thing just to mention is, I think, so like I say, although coding was super valuable to me and it definitely like helped my journey, and I think it is a really useful asset to have as someone in product. I don't think it's an essential, and I also always caution people against, like, don't learn it for the sake of it. I think, as we touched already, like, it's not like medicine, so tick box. It's like, get your 5 quality improvement projects, get your 2 publications. It's not like a learn to code checkbox, I think, because if it's not something that resonates to you, that you don't really enjoy, there's no point just bashing yourself through all these online coding courses if it's not something you're interested in, because there's so many other things that you can do that don't necessarily need that skill set, I would say. So I think if it's something that you love and you enjoy, definitely lean into that, and it's really valuable. But don't learn it as a tick box. Learn it because it's something you want to do.
Definitely. So tell me the story of co-founding Avid. First of all, what is Avid? Actually, let's just orientate ourselves there. What is Avid? And then tell us the story, the practical, the very real. How did you actually do it? How did you co-found Avid?
Yeah, sure. So Avid, essentially we sit in the preventative health space. So we say Avid is designed to activate proactive health action for people. So we basically build out programs that are delivered through an app that help people tackle sort of risk reduction, chronic disease. So how do we get people to take action for their health a lot earlier? Through the power we have of digital, so you mean app-based things that can nudge people, that can guide people, that can kind of gamify the experience. But then we also have a clinical layer. So we're a CQC registered clinical service, which was really important to us from the start. So it's not just like an app, but actually we've got a team of health coaches, and you'll match one-to-one with your coach, and you'll work with that real human person as you go through one of our Avid programs. And then it's always overseen by a clinician as well. And then with that CQC, we're now looking at, or including prescribing, including testing, we're able to stretch the scope of what we do to kind of genuinely impact health. So say it's a blood pressure program, lifestyle is a huge part of it, behavior change piece, supporting people to take the action, but then when needed, we can also add that clinical lens. So overall, essentially a platform to deliver programs to help people take action a lot earlier for their health.
Nice. So the co-founding of it, where does that begin? What were you doing before? Like, how did you get into this, basically?
Yeah, so it actually started in those academic days that I had, as I was very fortunate. I had very lovely academic supervisors who were sort of generally happy as long as I was doing something that was related and I could show I was using the time
well. And before I forget, I'm just going to add here at this point, it's one thing I actually wrote down to ask you or mention. Doing an academic program gives you a day a week, right, to just do academic stuff. What an absolutely incredible thing for clinicians like yourself that are creative and like building things, to just give you time. Give you time. And this is one of Keith's things that he says, actually, of like, all these tools that are going to speed up GPs, like the AI scribes and like all this sort of stuff. And everyone's like, oh, what are we going to do with the time? Keith's like, no, don't worry. Doctors will make the entire system better if you just give them time. And I think you're a great example of this, because I hear this a lot. Like, this seems to be like the sought after program now, because you're just off the hamster wheel for a day a week and you can just let things percolate and you can let your ideas run and you can, you tell me, like the day a week thing, of course you've got academic things you're trying to do, but I imagine, because I remember this from my fellowship year, moving to a 9 to 5 as like, SHO reg level, like you really notice the extra time in the evenings and your ideas start flying everywhere. But you tell me, like, what do you think about that sort of day a week thing? Should every junior doctor get a day a week?
Yeah, it's tricky. I mean, so I think the traditional academic program is you get a 4-month block to do research. So one of your 6 rotations in foundation year. So I think it might be Wales and maybe Scotland that have this. They were like, oh, we'll do it a day a week instead of.
Fine.
So I mean, yeah, it's like, so it worked really great for me. I think protected time is something that's really important. And actually, again, maybe another tangent, but I'm part of one of the working groups for the 10-year health plan with Darcy, and a lot of it will definitely all come out. So there'll be a lot to read shortly. But a lot of
What's that like, by the way?
Yeah, it's great. I mean, it's just a room. They've just assembled like all the most kind of interesting people in the space. It's been really interesting. They brought me in and a couple of the NHS clinical entrepreneurs just to bring that, hopefully, that lens on people who are in the system actually trying to get these innovations into the NHS. But they've also got a lot of people from, the HINs and all other sort of organizations. But a lot of the discussion has been around sometimes changing culture. But actually, I think it's not so much the culture that he's changing. It's actually all these mechanics, right, that lie underneath it. And it's the motivators and the system itself, and then I think culture follows. So things like protected time, as you say, just actually, we always ask clinicians to do this, like, especially in quality improvement projects, I don't know, publications, as healthcare professionals, as clinicians, you have to kind of do it in your day job, but actually the day job is pretty busy, right? So having these sort of protected areas to be like, whether that's, I don't know, research or innovation or whatever. So for me, it was really great. It did mean that you had a day less a week of clinical work, right? So I think you had to prove that you'd still reach all your clinical credibility, kind of sign-offs and things in that time. So whether it's for everyone, I don't know, but it worked. But
anyway, the journey to starting Avid starts there, you said. Sorry, I interrupted.
Yeah, well, no, I think it's a good point. And also, I think a lot of people are always wondering about, like, how do you go from like clinician to startup, and like I think that was a good way to sort of reduce that risk for you personally. So I think that's quite whether it's a day a week because you're on a program, or whether you're doing it in your free time, but always try and encourage people to like just start it alongside the day job.
Well, this is what fellowships were for me. It's exactly the same.
Yeah, and then I think it might be my mum who said this to me or something, but when I was making the switch and I was like, oh, you guys are quite cool about me like stepping out of medicine and doing startup, but there she was like, I think like that one day a week is the day you seem to enjoy the most and have the most fun on. So maybe if you do that one day a week for all your days, and I was like, that's a really good point. Like that would be great. I'd love that. So yeah.
Wow. Anyway, so what happened starting there?
Yeah, I guess we just started building. So like I say, Jean was always like a real great guiding force on Avid, who sort of I think had a real passion for the need for this prevention piece that he saw.
So how did you meet? Sorry, so in terms of just like the super so you're doing. I mean, you mentioned like doing the day a week thing, or not day a week. You had the 4-month program, etc. But you're on this academic program. But like, how do you meet someone like that? Like, how does this idea? Like, do you talk about the idea before going in? Like, how did you make the decision to actually do it? Like, let's zoom in on that.
Yeah, it's a good, I guess. Yeah, I suppose it's a fairly. So I think I was aware of Jean from the clinical engineer program. Like he's one of the kind of advocates. So I think I knew of him, and then we lovely ISSM coding society is still going strong to this day, which I love. There's a bit of a model where people who learn to code then come back to teach the rest to code, and it seems to have created this little wheel, which is nice. So glorious. I came back as a speaker. They had independently to me got Jean as a speaker. He gave a great talk, as you can imagine, super inspiring. And then actually I cold LinkedIn messaged him afterwards and just said, thank you for taking the time. Like, it's something that's quite close to my heart because I founded this a couple of years back, and I think talks from you guys, like people like you, can actually be like really inspirational. So he gave up a Saturday morning for like an hour, and he's a busy guy. And then very Jean just replied saying, we should talk. What's it? What's your number? So then I met, and then we had a great chat about careers and stuff. And I was saying, I'm looking to do something different. He said, let me introduce you to a few people and let's see how we go. And then, like I said, I had the luxury of having that day a week to play with, I think. So we could just start building things. And then, that kind of
Amazing.
formed the
So how were
foundation.
you sold on the idea at the time? Like, has it changed to what it is now? Like, what was the initial discussion on what Avid was or what it was going to become? Like, were you sold on like like a
Mm,
moonshot vision, or like how are you sold on this as like a solid way to spend your time? And I guess the reason I
yeah.
ask is because I think a lot of people listening will be looking for a way to get into the startup world, or even maybe they're not looking for a way to get into the startup world, and they just have these types of offers come across them. Perhaps not from someone that's sold a company to Medtronic and it's more of an obvious thing, but people. I mean, I can remember having it when I was at the accelerators and doing that sort of stuff. And you're visible to quite a lot of startups, and a lot of
Mm,
people come up to me and just say, "Oh, I've got this idea," like, or I've got this memorandum that you can read at the time. A few people
yeah.
even sent, and then like, or I've got this, this deck, and like I've got got an angel investor on board. Like, there's these various like ways that people describe like how they've started
Yeah.
it or whatever, and it's hard to know like what am I worth currently versus what's this idea worth currently, and like what's the
Mm,
opportunity cost if I choose to do that. I'm going to miss out on other offers. Like, how do I assess this in terms of like how good it is for me to do it? And I think
yeah.
that's something that I can definitely relate to, and I know that others will feel the same. Of like, how do you know that that's a good thing to actually go and do? And I can appreciate, someone that sold a company to Medtronic's a bit different, but um, it's sort of like an easier yes. But I don't know if you had a framework of kind of analyzing how good the idea was, or maybe you're just thinking actually this is just a good ship to be part of and hold on to for as long as possible, and then or whether you're thinking like actually I can get the perfect role and I can do that, and I don't know, like how did you think of it in that moment?
Yeah, there's quite a lot to pick there, I guess. Yeah, I think there's definitely a concept around, I think it might be a YC thing of staying committed to the problem, but flexible on the solution. So we
Interesting.
definitely started out with like, you mean wanted to do something on prevention. The real hook at the beginning was around how we can teach people about that risk. Like how at medics we do Q risk, right? It's like, oh, you have 10% chance you're of a
Yeah,
heart
right.
attack in this time. But like, how do you actually translate that to something that people understand? And then how do
Mm,
you then actually make them take action? Because just telling someone a statistic doesn't
mm,
that actually changed that. So we sort of started there, and then it was around even the problem of prevention, right? How do we get care further upstream? How do we, but always from a bit more of a consumer lens, not necessarily as the people who pay for this, but more as like how do you get a patient and actually make them really understand and lower the barriers for them to make the changes that they need to do in order to improve their health. So I
mm.
think we've always stayed really committed to that. But then the solution, I say, has pivoted because initially we started maybe it's all digital, and then actually as we learned more and more about health coaching and that as a space and started running more trials, we were like, oh, actually, this human part is really, really key. And actually, again, it's all iteration, right, with startup. But
Mm.
you mean talking to the users, all their feedback that they'd give is like, oh, my coach Moira was amazing. And
Yeah,
that was like a real sticky account. So then again, we kind of changed that a bit. So I think have remained really committed to, what's the problem we're trying to solve? But we've added, and then also AI coming through now. We're doing stuff on like AI avatars. Where does that feature in? Does that feature in or not? And sort of staying flexible in that. But
mm.
I've lost my way from your question a bit. Sorry, more around.
But you
Yeah.
never had any doubts of joining this. Clearly, like you just your assessment of it was that this is a great opportunity. I guess my question is, what's
Yeah.
your advice to people at that stage that are maybe evaluating these offers from one or two person bands that are
Yeah.
selling them on a vision and an idea, and they might be in a nice stable job, they might be a director of something and all that sort of stuff, or they might be a clinician that's a registrar, and they could spend their time doing anything. But I don't know, like, what was
Yeah.
your framework for making the decision to
Yeah.
actually go and do this?
Yeah, it's a good point. I guess a lot of it comes down to personal factors, I suppose, at the time for like you say whether you've. I think I'm, unfortunately, I didn't necessarily have a lot of dependents or anything, and I was at a stage with
Yeah.
that kind of FY3 year where let's try something new, let's see.
So you had the
Uh,
flexibility from that. Yeah,
yeah,
okay.
and then I guess you've always sort of got that backup as a healthcare professional clinician where you're like,
Yeah.
that I could probably give this a year, and then if not, I'll apply for training and things. So I think I had a bit of a kind of, I guess it's all about reducing risk, isn't it? A bit of a framework for that.
Yeah.
But then also, to be honest, I'm not sure I'm that much of a planner for things. Maybe I should be more. So, I've
I
got
can.
friends
You're a
who are like,
fast
I'm
evaluator.
doing
Like even in this
maybe,
conversation,
yeah,
you're evaluating things very quickly.
okay, yeah. But I think I've got friends who are like, I want to do this. I'm going to do this training. I'm going to do this. This is like my next 10 years. I think I've
Yeah,
more
yeah,
just followed, for better or for worse, kind of followed my whims. And like, this is something that I think is really exciting and I want to work on. So I'll do that. And
yeah.
hopefully that will continue to kind of stand me in good stead. But yeah, different ways, right?
Well, I think there's something in that. Even I think there's something in that even that people can get too analytical about these types of decisions, and you're. Is it fair to say you're someone that trusts your gut on these types of things?
Yeah, I guess so. I suppose the other thing is that, especially for health tech, the spaces move so fast. So I almost feel like you can't necessarily, some of the stuff we're working on now today, or different opportunities I've done, or projects I've helped on, like, weren't even in concept like a year before. So maybe in a way, there's no point to overplan because
It's so
actually,
true. I say this to
yeah.
people all the time. I'm actually going back to my first school to do a talk,
Oh, I love that.
which is super nice. And I've got a call with the head to talk about like what I'm actually going to talk about. But one of the things that I always say when I'm speaking to people at that sort of stage, like very early university or sixth form or that kind of thing, is that everything I do now
Mm,
didn't exist or have a name like when I was their
yeah,
age. So to ever get bogged down by planning for what you're going to be when you're older,
yeah,
yeah, okay, if you've got a calling, if you've got all that sort of stuff, but if you're in the majority that don't tend to have that sort of specificity of how you see your life planning out for the next 20, 30, 40 years, then it's okay to do exactly what you said at the start of this podcast, which is follow your interests.
mm,
Because if 18 years old or 16 years old, I'd have said, I mean, you couldn't even say,
yeah,
I wanted to be a podcast host. I wanted to be in health tech because I'm interested in gadgets and I'm interested in being a doctor as well. And I want to combine those two. Like, none of this existed. AI, like
yeah,
all the technologies that have come and gone, like blockchain, all this sort of stuff. Like, it's just all over the place. And so, yeah,
yeah.
it's a real advocate for follow your interests. It's a wonderful phrase.
Mm,
The only thing that I would maybe talk to you about now, like a sort of a challenge to us both on this, is that whenever I say to people like follow your interests, people always then go, yeah, but how? Like, how do I make
mm,
money out my interest? Like, what's the what like? But they seem to want this very transactional. If you do
mm,
this, you get that. And I guess I came back to that thing before of like, I don't think you can consider this sort of stuff on that time frame in the world of even the world of startups or entrepreneurship or just
yeah,
frankly the world and getting a job, like coming up with the idea. If you're an
mm,
entrepreneur, you've got to set everything up, and the idea is the gift. You've got to be meeting people, you've got to be talking to people, you've got to be exploring that problem and going deep on the problem to figure out why is it that you're so fascinated by it. And the idea is a gift when you put the work in. I sort of feel the same about like getting a job in health tech or like
mm,
finding your thing, is that you went to those events, you went to those hackathons, you learnt coding, you spoke to those people, you messaged Jean a LinkedIn message that you didn't ask for anything, and you
mm,
got that right because maybe you'd asked for stuff before and didn't get a reply, but you figured out the right way to do it because you've done it enough. And then the co-founder role in the job is a gift. And again, I can appreciate that I'm reverse engineering the message here, but like I guess my point
mm,
is that it's not linear. It's not linear, this sort of stuff. And I'm a huge advocate for just do the work, like
yeah,
increase the surface area for luck to happen. And if it's the job, if it's the idea for a company, then optimize for what you can optimize and control, which are the conditions, and create the
yeah.
conditions for the idea to come to you. And the idea is the gift. I think that's the best way I've ever heard it. But
Yeah, no,
yeah,
I
I
love
don't know
that.
if
I
that's
think that's a
relatable.
really, yeah, I know, I think that's a really nice summary. And yeah, you pulled together a lot there into, yeah, no, I completely agree. I guess the only caution is just, I suppose, and I listen to all these podcasts. I love the founder story journey and things like
Mm,
that. I guess there's always the caution to people of it doesn't always, I think you have to have a bit of a leap of faith, right, in entrepreneurship, right? Because you're doing something that hasn't been done. And then there's just that thing that it might not work. And I think that was a bit of a harsh learning on startup life for me is like, you could do everything right and like work your hardest, but maybe sometimes like market forces are against you. It's just not the right time. We hear that quite a bit about prevention. You know, this is the great, but maybe the NHS isn't quite at the right place for it, and so
Mm,
it's tough, right? Like, so yeah, just I don't know, not a very succinct point, but I think it's easy. We said at the beginning, like to look at the grass is greener, but you mean that that's not
mm,
necessarily. So it's not a linear path, and actually by
mm.
being a wiggly path, sometimes that means you do have ups and downs as well. So
Exactly, and don't worry, this is
yeah,
not a succinct podcast, so
yeah,
this is the place for context. So let's
yeah,
talk about that a bit then. So prevention,
mm,
prevention in here we are in 2025. You've got an NHS that is very good at sick care, very good
yeah,
at you break a limb, you need intensive care, you have some chronic conditions
hmm
that are well treated by the NHS. But this thing about prevention, like our expectations of our own health have increased so much of what
yeah,
healthcare even is now. And the line between prevention, healthcare, it's so blurred. And
yeah,
you can sort of see, and I can sort of feel the NHS grappling with like, what's our role here? What's expected of us
mm,
from an NHS perspective in terms of prevention? Because if you go really extreme and go for the whole like MRI once a year and then fired into private appointments for every lump, bump,
mm,
scratch, lesion to get checked out and bloods done every month and all that. There's the optimal, the Brian
mm,
Johnson
yeah,
spend
the like
2 million.
longevity kind of.
Exactly right. So there's
Yeah.
the let's go. In fact, let's put that marker in the sand. There's the Brian Johnson like let's spend £2 million a year, and
Mm,
let's call that what we think is optimal prevention in 2025. And I can have a great discussion on that guy because I've seen a lot of his content recently and massively changed my mind on him, which I think
mm,
is the idea of all this content recently. But there's that, and then there's go in when you've got a symptom.
yeah,
And so, how do you, I mean, that's how I see it. And I think, NHS is going when you've got a symptom and it's trying to sort of reach into the prevention
yeah,
world, probably under a bit of duress of like, oh my God, we've got the same budget and now you're expecting us to go across prevention. Like, what's
yeah.
our role here? Screening tests, I guess, is where it goes in. Okay, we've decided that this is financially viable, that if we catch this stuff early, it will save money down the line. And I guess that's
Mm.
where NHS prevention is. But you tell me, like, how do you see like the prevention landscape and where does Avid fit into that?
Yeah, it's a great point. I'd say I think I mean, no doubt about it, the NHS needs prevention. Like there's rising waiting lists, rising decreasing workforce, spiraling costs, spiraling outcomes, like it's sort of deteriorating outcomes. I think obviously prevention is the solution, but in terms of mechanics of how we actually do that, as you say, in a
Yeah, right.
resource resource strapped scenario is really challenging. So yeah, I suppose the way we see it is you've kind of got NHS, you say, which is amazing at acute care. You mean break your arm, head to any, they've got you. Like that's
Perfect. Yeah.
sorted. But as you say, there's this pull to be more and more prevention, and where does that line sit? And then you've kind of got public health, which do you mean stop smoking campaigns, weight loss campaigns, but they're not necessarily very clinical or even really accountable to outcomes. You mean no
Well,
one's
Public
necessarily
Health England
measuring
got
these.
disbanded, didn't it? And that's now basically moved to YouTubers. YouTubers are now the new public health. So, like,
Well,
that's
exactly.
basically the model there.
Yeah, so we
Outsourced.
see there's sort of, and then you mean people in their communities, in their homes, you've kind of got this big gap, which is,
Mm.
and then again, this is more the avid mission, so not to sound too sort of grandiose,
Yeah,
but
yeah.
actually, what we really want to fill is this sort of almost like a digital front door, like a new layer of proactive healthcare that probably sits ahead of the NHS. Maybe you
Yeah,
obviously interfaces with it, but actually, this isn't necessarily something the NHS is core or built to do or has you mean has the processes and the systems to do, but
absolutely.
actually it's going to need to be more digital. You mean the number of people, everyone's got a smartphone now, that's how people interact with their banks, with
Yeah.
e-commerce, you're booking a flight. I think that's the layer, that's the level we need to get to for healthcare in terms of being out in the community, and then it's knitting together services, it's interacting seamlessly with existing clinical services, which I think is really important, so you're not increasing
Mm.
the burden. But yeah, it's a new form, and I think it needs to be. I don't think it's going to come from the NHS. I think companies such as you mean who are a bit more deeply rooted in technology, but with that clinical lens, I think hopefully will fill it. So, yeah, the goal for Avid really is to sit ahead of that, have that prevention layer. My real ambition is to get to people before they're sick. Right, that's the goal. Is
Yes.
before you even get your high blood pressure, high cholesterol, we have the technology now, right, to be picking up people
Yes.
at risk, and we also have the technology to engage people and give them the guidance and hopefully
Mm.
we lower the barrier to change. But at the moment, more practically on average, we are working more with people who have high blood pressure, have high
Got you.
cholesterol. just for practicalities
Got you.
reasons, all of
Understood.
that. But I would love to keep pushing that out farther and further.
Yeah, that's the thing. But it is a process, isn't it? And I
Mm,
think it's like I said, you've got the, if I have a symptom, I go in. And then I think you've got screening programs.
yep.
But then there's the whole, okay, what's the next bit of prevention? Because the next bit,
Mm,
and I think the stuff at that end, clear ROI. Clear ROI on if you do this prevention, it's better economically for the system and the country in a public health system. So cool, get
mm,
it. But there's also the undiscovered bits of prevention that
yeah.
are better economically, but the NHS can't experiment to find that out. Now, you can
Yep.
make a case, and that's where screening programs come from. Obviously, there's an economic analysis, there's national data, and all this is crunched to figure
Mm,
out, okay, look, on balance, the screening program is going to cost this, but actually, by doing smear tests, we're going to pick up cancers, and therefore we're going to save down the line. And obviously, that's better for patient level, it's better at system level. Perfect. We'll do a screening program.
mm,
And that's the thing about this next bit now of like, how do we discover those bits? And broadly, that is the role of the startups and the private sector to kind of figure this out, because you're quite right. By figuring this out and by looking at this economically,
mhm.
if private companies are able to make a profit, then there's a role for then partnerships with the NHS to then bring that under that kind of NHS umbrella and develop services with, I guess. If that's
Yeah.
something like, is that kind of where this lands?
Yeah, there's
Is
definitely
that the
some sort
future?
of win-win-wins in there, I think, for patients, health system, and companies, and it's just
Yeah.
sequencing all the things together. I think the other point maybe to pause on is around like the action step. We speak a lot about Avid, so like say, amazing, more screening is only a good thing, especially there's a lot of great work at the moment into the health inequalities piece, like getting screening to the people who don't necessarily traditionally engage with it. We've got these kind of risk algorithms able to use what we find from screening, but actually the uptake is still low. There's still a battle there. I think the uptake for like health
That's
checks is
interesting.
still way under where it should be. But
Really.
I think the problem is, even if you find these people, then what are we doing with them? Because actually the system isn't ready. You say you put a screening program in, you're going to find another, I don't know, X hundred people who have high blood pressure, but that under-resourced, overwhelmed GP is not going to be able to pick those guys up and
Ah, I
put them into
see.
stuff. So I think that's again where we hope Avid can sit, is that sort of additional piece. Great, you've got this population, they're at high risk. Here's a digital program. We've got the human health coaches, so it's bridging that gap between, it's not just digital, it's also part clinical service, but it's really scalable, which I think is maybe what traditional systems can't do as well. All our coaches
Mm,
are remote, we kind of dial them up, dial them down, depending on
mm,
the demand that we've got. And then at least you've got that like first frontier. And actually, there will definitely be people who need to be escalated. They'll need medications, they'll need more, maybe taking blood
mm,
pressure as the example, that they will need, the proper GP. But actually, maybe, I don't know, 50 to 90% of that group, you could probably take through at least a 12-week program that generally
mm,
kind of sustainably changes some behaviors to do ahead of time. So kind of, yeah,
mm.
putting all these, we've got a slide in our deck that's kind of like the time is now, but you got more and more testing, cheaper and more accessible than ever. You've got a great sort of government momentum for prevention, at least, even though we're
Yeah.
kind of still figuring out the mechanics of what that looks
Yeah.
like, or at least NHS system, ambition to be more preventative. Then you've got, I think we touched on this, the kind of consumer demand. People do want to take more ownership of their health, and that's why people are paying for these, gigantic all body scans and things. I think people want to be taking more action early. I think maybe post COVID as well, we're a bit more kind of
Mm,
health aware.
mm.
And then kind of our fourth bucket is then just that AI piece of, I think this is a way that we can take high touch human support that's bespoke and personalized, but actually scale it to kind of population levels. So how
Mm,
can we leverage all these different factors to hopefully
mm.
bring together into like a cohesive solution?
Yeah. So let's talk about the model then. So is this private payer? Is this insurance that you're talking about? And how did you decide? In fact, first of all, what exactly, I know you've been through this slightly already, but like in detail, what
Oh
is
yeah.
it that you're actually doing for those people? And why did you select that? Because again, in the prevention space, you can go from full body MRI and fire you down everything and do everything after that. There's blood tests and doing that once a month and then similar, but then there's holistic lifestyle clinic type stuff, and again talking to human beings, which you talked about, and and that being a way to change behavior. So how do you kind of, how did you what is the model commercially, I guess, and how did you decide on it practically, I guess, from a product perspective?
Yeah, maybe I'll take product first, I suppose, just in terms of what that
Sure.
flow is. But I'd say I think the real focus for us was on the action piece. I think the way we saw the problem was that we're not struggling to find the people who need it. We're not struggling to basically
Yeah.
give full clinical care when people really, but it's that gap in the middle of actually once you found a person, what can we do with them? Where can we send them? So, I mean, the sort of user journey that I like the most, that we do a couple of different things at Avid, but the one that I like the most, that I think makes the most sense in terms of the system, is working at GP level. If someone flags up at, for example, we've got a healthy heart program, so cardiovascular risk. So if someone flags up as having high blood pressure, high cholesterol, any one of, you mean the metrics that we set,
Yeah.
the first port of call is that we invite them to take part in the Avid program. It's all digital, so you mean they get a text, they respond to it, and then they come on through to us. They meet our Avid team. We work closely with the practice, you mean around bloods and around the handover, but actually we take them through a 12-week program that is predominantly sort of lifestyle activity based, but they'll get a health coach every single week. They'll set their goals, and then hopefully we then sort of deliver them back at the end of the 12 weeks, much improved with what we're starting to prove out with our evidence base is actually sustainable changes. So not only have they lost weight, so on average people go from 32 BMI to 28 BMI in the studies that we've run, but actually they keep it off, and we've got a lot of qualitative sort of testimonials on, you mean this has been a step change in how I'm
Mm.
living. This isn't just like a program for the sake of
Yeah.
12 weeks. So that is I think that's where we best sit, and that's where I want us to sit. But I think we're
Mm.
still working through the mechanics of how, who and where kind of pays for that, I suppose, because I ideally don't want it to be patient paid. I'd like it to be part of the system. And then in the meantime, as we sort of solve for the NHS, and like I said, we've got a lot of different kind of routes we can dig into a little bit more, but also working with pharmaceutical companies. So there's a real uh, momentum now on those sort of wraparound digital programs. So you're not just maybe the GLP-1s, not to, I don't think we want to go down that. It's probably a whole episode and tangent in itself on GLP-1s, but you mean these drugs shouldn't just be given as drugs by themselves that people are on forever. There's loads of different side effects. I mean, they're not long lasting, they're expensive. So
Mm.
putting behavior change around that, and that's something we're kind of starting to follow through a few good threads on where Avid can come in with the components of the education piece, the coaching piece. We do a lot of tracking, so a lot of progress tracking, symptom tracking. We send EQ5D clinical surveys, where that can kind of then augment just giving someone a medication as well.
Mm. So you're
So yeah.
really so you're, I mean, you're in the thick of this now, like with the go to market, right? So it sounds like this is it's probably quite a super exciting time, like probably a lot up in the air and a lot of decisions being made and stuff. So what's it like being in a startup, like doing this sort of stuff and these kind of big decisions, versus I guess what you've done before in your career?
Yeah, I think it's a good learning point for me on that conversion, on just like building a great product that patients love. You mean that drives clinical outcomes. That was sort of like my initial guiding star, was like, we'll
Yeah.
just build something that really works. You mean it from a clinical
Yeah.
perspective. Like I don't just want it to be wellness for the sake of wellness, but does it, and we published papers on this, does it statistically significantly reduce the outcome that we want? And then patients love happy testimonials of people say, you mean this is something I really enjoyed using, and they stick around. But then it's just that flip to then someone needs to pay for this. It's not
Mm.
enough to just be a good product, and who in the system will that? You mean who in the system has resource and capacity to do so? So yeah, it's a big sticky problem, but it's fun to solve and work our way through.
So earlier you mentioned about AI avatars, which sounds interesting and exciting and potentially terrifying. It's not terrifying, obviously, but
Yeah,
like
yeah, a little bit.
these things, these things can mean lots of different things to lots of different people. So tell me about AI avatars. What are you doing? What are they? What are you using them? Are you not using them? Are you? Yeah.
Yeah, it's a super exciting space, right? That's moving so fast. Maybe one that we're exposed to a little bit more, maybe than you mean more of the general public. But I suppose for us at Avid, the question is, I mean, we've got these programs with these human health coaches that really work. People, you mean, adore their coach. They stick with it. They you mean get the clinical outcome that we want. They stick through the programs at the retention level. You mean 91% that we want. But there's inevitably always a ceiling on human on any sort of human workforce. And I mean, this also comes through more when we're talking to VCs and things as well, on like, what's a VC backable company, what can be a mega company. And then you kind of have this world of AI, sort of both chatbots to voice personas, all the way through to those like AI video avatars that I'm sure we've both seen, that are
Yeah.
looking more and more uncanny and more human-like, which is slightly terrifying. But again,
Yeah.
represents, I think, a really big opportunity. But I think we talk a lot about Avid as to like where that balance is. So our approach to this basically is that we've started with what really works with the human side. Where can we start to dial up on the automation side? So starting with just admin stuff, which is easy enough. So we have a web portal that coaches and clinicians use to manage the clients. So things like note summarization, like booking prompts, like all these sort of things on the back end that the patient will never see, but really speeds things up. So a bit of a no-brainer. So clinicians and coaches spend their time with the people rather than on admin, which is what we all want. But then this new frontier of like when you start to surface these AI tools to patients, and I think we've seen this done wrongly in a lot of ways. So I think just a chatbot that's digital only, that doesn't engage, that isn't personalized, like we've seen that people switch off from it. So we're trying to find that balance point on preserving that human piece and accountability. But at the moment in our kind of R&D testing, it's an avatar who steps in between sessions. So you've got your coach, you've got your human who's looking after you, but if you've got a question at any time of day in between sessions, it's an avatar. They're trained on all the Avid content. They also know you, I think is important. They're trained on your back. So you could say, you know what, I can't remember, what did we chat about in that last session? What was the goal I set this week? And then they can kind of step in. So, but again, this is all sort of testing out where the line is on where we don't compromise on outcomes and retention, but it's a win hopefully for the patient, on where they can get more support and they can feel. And actually had a really great conversation this morning with engineers on sort of voice personas to navigate through the app. So a question we get a lot is on digital exclusion. So obviously you've got kind of more elderly demographics. Our solution is predominantly put through an app. So if you're not tech literate, you can't use apps. Like, is this for you? But actually, I think, yes, 100%. I'm happy to dive that on a tangent as well, of like the things that we've done to try and make sure that it's accessible for everyone. But actually, maybe instead of an onboarding, it's just a voice conversation with a really friendly automated voice who says, you mean, how are you today? Like, tell me a bit about your background. I'll funnel all that in. Here, I've pre-filled out all of your sign up stuff. Or instead of them going around being like, how do I book a call? Where do I find? You can just say, hey, can you book me a call for 3 p.m. tomorrow with my coach? And then it can say, I have. So
it's interesting, isn't it?
Lots of different fun features, I think, that we're testing out with.
Yeah. It's interesting, isn't it? Because you mentioned retention and outcomes, and you've got to find the line between retention and outcomes. So baked into that statement is an assumption that there's an optimal range. And I think actually one thing that I've kind of got on my journey with this is that it's not just that AI is less good than human. It's not as simple as that. It's just not as simple as that. It's about saying that for certain clinical conversations, AI can be better. You can be more honest with an AI about more taboo subjects or embarrassing stuff, or there's multiple. So there's like a thing there. There's also that for things like very quick admin, can you just change my appointment time to blah? There's a very human thing that some humans don't want to bother other humans with that. They just want an interface that will just solve the problem. And actually, there's an optimal range there of using the AI that you can find by using the AI in those types of scenarios.
Yeah.
And so, yes, we need empathy, human to human empathy, to get very good history taking or very good outcomes in lots of different ways if it's used in the right way. But I guess what I'm learning, because this is very much a journey here, is that there's an optimal place to find, and it's not easy necessarily to find that. This is the experimentation phase of that, because the other thing that has really come to mind for me and that I've seen firsthand is that all the literature on, I say all, I mean most of the literature that I've read on the value of human empathy and sort of building the case as to why human to human should be maximized as much as possible. All of that research is pre LLMs. Not far pre LLMs, but it's pre-LLMs, a lot of it. And actually, some of that newer research on empathy and of, I'm not going to bore you with it, but like AI is very good at one of the three types of empathy, cognitive empathy. It's very good at reflecting back to you. That sucks for you. That must be terrible. Like, you must feel really bad. Like, I wonder if this, like, it's very, very, very good at that. So they say that AI is very good at synthetic cognitive empathy. Very, very good at that. But it's not. It's not got emotional empathy, and it doesn't have motivational empathy because it lacks emotions and it lacks a motivation. So what you receive as a human on the other side is that. So it's it's very good at those things.
Maybe two
But
things as well. One of them is that I think the line on AI and humans is going to be different also for different people. So it's
yeah,
something we're kind of really, we're looking into, and not necessarily just age demographic, but actually, you mean there's some people who would love to just, I don't know, maybe if I'm booking a flight, I hit a blocker. Actually, chatbot fine, like I'm happy if there's
yeah.
a problem, but other people really do want a human. So hopefully,
Mm.
we're building into our model different routes, so actually people can kind of take the route that, and
Oh,
then for
that's
those who are happy
interesting.
with AI, amazing, but for those who really do want a human, then fine. But we can kind of find that balance in
That's
there.
really interesting. So you end up
So,
with sort of like a blended
hmm,
model, like very personalized per
yeah,
person. Is that kind
yeah,
of so? How are you? You mentioned that you wanted to go on a tangent, talking about
yeah,
some of the things that can make it sticky and things like that. Do you want to go? Do you want to go through that?
yeah. I'll also just quickly say the regulatory line because I feel like this is a
Oh,
topic
of
that comes up a
course,
lot on
yeah,
podcasts, but I do want to call out that that is another thing to be very mindful of as you do these, whether they're voice personas, chatbots, or admin,
yeah.
but knowing, I suppose, where that line is and where you're just automating, where you're speeding up process, but the human has final sign off versus when you've stepped over into that software as a medical device line. But maybe just,
Yeah,
I
and
would just wouldn't want
just
to
on that.
speak too
No,
freely without
completely
calling that
fair.
out because that's quite an important one.
Completely fair. And just on that, I depends what side of the bed I've woken up on. Like, to be honest, of you know
Yeah.
AI scribes are dangerous because they can hallucinate, and then you get hallucination on hallucination, and you get like
Mm,
to the power of errors happening, and yeah,
yeah.
there is that. But then on a different day, it will be my like more common sense, like, oh my god, can we just do this and deal with some of the problems downstream? Because actually, but then you're like, oh no,
Yeah.
but what if it's like significant patient harm? Like, you can't just rubbish that away. And you're like, well, would it really be
Mm,
significant patient harm if the clinicians are signing off the notes every time? And it's like, well, the odd thing would creep in, but then the odd thing probably creeps in anyway, of like not asking
yeah, this
about
is the
PR
thing, right?
bleeding and like all this sort of stuff. So then, should we really be analyzing one against the other and going like, well,
Yeah.
on common sense we should do blah because we get all these benefits, but then what are the benefits? Are you really seeing more patients, or are you just getting more
Mm,
time? Are we really using that extra time? Like, it's just like a.
What's the risk of the current practice though as well? You mean someone's overwhelmed, overworked, then actually there's, yeah.
And then there's the whole thing about how is it changing us? The use
Yep.
of AI and the use of all these tools and all that sort of stuff. How is it changing us? I was venting like literally a couple of days ago, and someone raised the point that part of being a junior doctor, F1, F2, ST1, ST2, or CT1, CT2, the
Mm,
first 4 or 5 years of being a doctor, a lot of what you are learning through is the synthesizing of information into notes, and it's in the process of
yeah.
that you're doing a lot of your cognition. And does this have a significant negative effect on medical education when you're removing that from people? And it's like,
Mm,
but then you're like, yeah, okay, if you need to be exactly the type of clinician that we have now. And you're like,
yeah,
do we need
exactly.
to even be that type of clinician that can do that? Do I need to do maths in my head if I've got a calculator? And you're like, well, okay, well, there are examples of needing
Mm,
to. Like, do I need to become proficient with a stethoscope if everyone's getting an echo? Or if everyone's wearing like
mm,
point of care ultrasound around their neck instead? Like, do we need? So I don't
yeah,
know.
it's
Like, and these are all like philosophical questions that
mm.
I bore myself. It's what I do when I need to go to sleep. Just think about some of these
Well,
things.
no, they're the big problems to solve, right? As you say, yeah, it's going to be interesting how it all plays out. But
Yeah.
yeah.
But anyway, yeah, you were going to go. I interrupted you. But you
Hmm.
were going to go on a tangent before about was it things that make was it things that make it sticky and like those types of.
Yeah, I suppose so. I guess what something that's really important to us to build into the Avid product is just I guess the power of like how you, because we want to change behavior, right? And we want to make it easy for people, and we want to make it seamless for people. And I think a lot of prevention is just engaging people. So we always
Yeah.
present, when we present our engagement metrics first. Actually, we're like, you know what, got 91% retention through the end of a program, and an NPS score, people are familiar with, you mean 87.
That's
like
pretty
people
impressive, by the way.
yeah, it was super proud, but people are recommending it to their friends and stuff. And then actually the clinical outcomes bucket, is highly important
Yeah.
in both clinicians, but that comes secondary, because if you've actually got someone who's going to open your app 2 or 3 times a day to do a health activity or to learn something, and they're sticking around and turning up to everything, that's the first frontier.
So is that what it is, by the way? So how long is a program, and what does a program consist of to get that 91% through?
Yeah, so on average they're 12 weeks long, because you find 3 months is about the right time to sort of really, make a change. There'll be some dips and troughs through that, and then you're helping someone figure out that they can also get themselves back on track if they do fall off it.
Yeah.
And then you're getting a health coaching session every week that then we stretch out to fortnightly towards the end, because we're trying to transition. We're here to help, but we want you to be able to do this by yourself. That's the goal. And then you're basically getting content every week. Maybe something actually about being sticky is, so you're getting content every week, and then you're also tracking things. So if it's a weight program or a healthy heart program, you're putting in your weight each time as well. But I think on the content piece, something we discovered early on was, if you give someone a library of like 100 pieces of content, and you're like, here it is, like here's everything for you to read, actually no one actually really wants that. It's not very helpful, and no one reads anything. Whereas what we then started doing is saying, you know what, based on the conversation you had with your coach, based on what week you're in, here are like 3 things that we think you should read this week that would be most helpful to you on this journey. And then actually, almost without fail, people will then read that. And I think then that's also that human piece of, Coach Joe, Coach Moira has asked me to read this. They're going to ask me about it, so I better read it. And actually, I'd say that works really well. So a balance on that human piece, but then also just keeping things curated. I think at risk, in the current healthcare system, we're at risk of often just, we speak about this, but like giving someone like a leaflet to be like, go and lose weight, here's a leaflet that says some dietary changes you can make, and realistically that's never going to really stick, right? So we need to pull in some of these other factors. And then we look at like Duolingo a lot as a great example of like gamification, and we're all hooked on like getting our little trophies, but I think there are learnings from that we should be bringing into health to get people to engage.
I think that's a really important point, that again, intuitively, we've both been clinicians in the past, like intuitively we know that there is so much left on the table from just sending people away with a leaflet, knowing full well that they're not going to absorb information. It's crazy. Like the other day I was in the dentist, right, and I've got to have some wisdom teeth out. They're sort of sideways and causing issues or whatever.
Nasty.
Yeah. But beyond him saying that, like, this is not going to be the easiest in the world because you've got a complex relationship between the nerve root and the root of your teeth and the nerves underneath, and your lip might lose feeling if we get this wrong. Beyond him saying that, I've then forgotten like literally everything else. I've forgotten how long the operation is. I've forgotten what type of anesthetic I'm getting. Like I've genuinely just forgotten. Like, or I've literally just not. And I can deal with this information. Like I'm someone who's really informed about this sort of stuff. Anyway, I can remember him saying something like, "You've got some calcification on the thing." Anyway, like I remembered afterwards, like, "Oh yeah, I wonder what was happening with that." And I get this email through of just like, "Oh yeah, by the way, there's like, it's probably fine. It's probably just just like a really tiny stone in your saliva glands, but also it might be a tumor. So like, we just need to get a radiologist to report this." And then you're like, "Oh right, okay. So now I can't concentrate on anything for a week, waiting for this like radiology report. So I send it to like as many friends as I can possibly find in radiology."
But you've got that clinical background as well to be processing.
And I've got the clinical background. And I think there's so much to that for me about this type of program that you're talking about, because if I had just the person to go to that can then just help me just process this information a bit better, in terms of actually doing the thing that I'm then meant to do afterwards, I'm far more likely to do it when I'm in a much more calm state of mind than in a panicked one about, oh my God, it might be this state, like I'm probably fine, but I might be dying. Like, which is what, let's face it,
When you're
anyone
in
who's
that
ever had
moment.
anyone who's ever had a symptom ever or been to the doctor and had anything ever has literally had that same feeling of like, it's probably fine, but I might be dying. Like everyone's
Yeah.
been there. So like your ability to absorb information, your ability to actually do the things and comply to what's expected of you, is obviously going to be diminished. And so it's just that, I guess, again, just intuitively, if we had infinite resource, we'd have a companion through our healthcare journeys at all stages. And so it just seems, I don't know, like appropriate, normal, like needed.
Yeah.
That
Yeah.
if we're
It's
going through
pushing that
something to
out,
set
isn't it?
habits, we need this person that's like biased. And so I guess my point was
Yeah.
going to be that the word balance that you mentioned between human and AI, and a willingness, especially even at that individual level, or at least for that individual for a certain time during the program, you're willing to increase the human rather than just set that stuff in stone.
Yeah.
I
Yeah.
think that's incredibly important.
Yeah. I think maybe also a point on how I suppose we use that, they said that health coaching piece. Because yeah, a lot of time you don't necessarily need a fully fledged GP to do a lot of that follow-up stuff and that kind of accountability check. So I think the health coaching maybe we probably don't have time to delve into, but it's a really interesting space, I think, in that it is quite grey and quite ill-defined, but I think there's a lot of value to be found there. So when we use health coaches at Avid, it's not just sort of coaching for the sake of coaching, but actually we set out our protocols. We say, this is a 12-week program for healthy heart. We'll cover these things week to week. This is what the evidence base is on diet. This is the kind of stuff that we're pushing forward. But then within those sessions, you as the coach, with all the skills you have as that human of empathy and rapport and goal setting, you'll then flex. So for the patient, it hopefully feels very kind of bespoke and very individualized, but they're still running a fairly repeatable, consistent framework that then we can kind of duplicate with other coaches, in the same way. So it feels more consistent. But that's again another balance point that we try and find is personalized, but also adherent to evidence base and fitting the kind of set protocol so that we can repeat it from program to program.
So, yeah. Amazing. Well, Laura, listen, I've just spotted the time. We've run out of time, but it has been a pleasure. If people want to learn more about you or they want to learn more about Avid, what's the best way for them to do so?
Yeah, so we're always keen to chat to people. So website www.avid.health and then hello@avid.health, and always keen to chat to anyone doing anything of interest in this space for sure.
Perfect. I think anyone trying to help with prevention and find a model gets my vote. So yeah, wish you all the best, Laura. We'll see you soon.
Amazing. Thanks so much, James. Really enjoyed it.